Okay, today's section for coding is going to be on diseases of the blood and the blood-forming organs. So I'm in your Bucks textbook, page 114. This is going to be a really short video. There's not a lot to cover for this section. Probably the most common blood condition that you're going to see all the time in the doctor's offices is anemia. Now, there are many kinds of anemia. And if you've not done the blood chapter for anatomy yet, this might be the first time you're hearing this. But if you've already done that blood chapter, you have already been exposed to the hemorrhagic and the hemolytic and the deficiency anemias. And so probably the most common kind of anemia is called a deficiency anemia, where the patient needs iron. That's the common anemia, but there's so many other kinds. Some of them are genetic, some of them are dietary, some of them are radiation induced, like from radiation exposure, like your cancer patients, things like that. So if you look up anemia in your alphabetical index, you have quite a long section. All right. So we have, I thought there was a chart. This is where I wanted to start. Okay, so we have all of these anemias here, which are these first three sections of codes in this area. Then we have coagulation defects, which is blood clotting problems, and then other diseases. So it's not a very long section, but let's get now to the blood clotting. There's a lot of different kinds of blood clotting diseases. Factor 1, factor 2, factor 5. You can see all kinds of factors with Roman numerals there. You can also have like hemophilia, which is a clotting disease. Okay. A lot of these factors are named depending on what is the patient's actual problem. Is it fibrinogen, prothrombin, fibrin? What is the problem that is causing that clotting problem? Sometimes you can have patients on medication like warfarin or heparin, which are medications to prevent blood clots inside the body. And then the others, one of the organs we talk about a lot in this section is the spleen, because the spleen is a blood cleaning organ as well as a blood storage organ. But then your other blood forming organs are the long bones of the body. Hematopoiesis, that's the word I'm looking for. Hematopoiesis, which is creation of blood, takes place in your, I totally spelled that wrong. Apparently I need my coffee this morning. Which takes place in the long bones. So that's pretty much all the lecture I need to do. There's not a lot in this chapter as far as intricacies that I need to explain how it all works. So for these 5, I'm going to have you code these. So for this one and this one, they're both anemia. So you're going to look up anemia and then what kind of anemia. For this one, you're going to look up the afibrinogenemia, the polycythemia, and the hemophilia are the words you're going to look up. Okay? So what I want you to do is to look these up. Pause the video now while you're looking them up, and then when you're ready to check your answers, restart the video. Okay, so if you have restarted the video, it means that you are ready to check your answers. I highly suggest that you actually coded these yourself rather than just let the video play through. Because you really do need the practice, and it's the only way you're going to see if you actually understand this section is by doing. Okay, here are your answers for these 5 questions. And not only are these the answers, it also tells you where in the alphabetical index that code was found. So for number 1, you would look up anemia, and then you would go to pernicious, and that's where you found it. For the next one, A, fibrinogenemia, and then acquired. Hemophilia, and then type A, okay, etc. So if you got any of these wrong, definitely look at why you got them wrong. If you couldn't find them in the alphabetical index at all, go do it. Follow what I have on the screen here and go do it and make sure that you can find it. If you did find it in the alphabetical index, but you were a couple of codes off, take a look at my answer and compare it to your answer and figure out why you went one way when you should have gone the other. By checking answers that you get wrong, it's going to build your coding skills. It's going to make you stronger and stronger at coding, and pretty soon you'll stop making those wrong choices. And so it'll really help build those skills.